Well, hello again. It's Dr. Jim Collins, and thank you for stopping by, taking a few minutes out of your busy day or night, and listening and watching to what I'm thinking about these days. Well, you probably know I think about CBD a lot. I wrote a whole book on it. I took 2 years reading and studying between 5 to 600 medical studies from around the world and here in the United States. And I've written on a ton of disorders and health conditions, emotional difficulties. I thought I had gathered information on just about every physical, emotional, psychological, psychiatric, neurological, neurodegenerative condition I could think of. And then I spoke with a gentleman who spent some time with me talking about an issue he was having, tinnitus. And I have to admit, this is something that I did not research years ago, but I have recently really got into the literature on this. So tinnitus is a condition that it can be frustrating, it can be aggravating, or it can really impair a person's life. And there is no medical cure for this. So most people who experience tinnitus, as I interviewed this fellow and as I did my research, most people with tinnitus will try to find relief any way they possibly can. So there are herbal supplements, vitamins, and minerals. There are hearing healthy diets to subscribe to. There are hearing aids. And of course, I would always recommend consult a hearing care professional, an audiologist, and really get some good medical advice. Okay, always start there. Now, CBD might be effective, and that's the whole point of me writing. This is a very lengthy, I'm going to give you like some silver bullets out of this article, but this article is online too. So if you want to find it and print it and share it with your healthcare professional or whatever the case is, please do so. But I did not realize that tinnitus is more common than I thought. As a matter of fact, it affects millions of people in the United States and around the world. So it's common. It involves ringing or other noises in either one ear or in both ears. It can be constant, which has to be terrible, or it can come and go. And it's associated with hearing loss due to exposure to the following: very loud noises, head injuries, whiplash, compacted earwax, age-related hearing loss, problems in the circulatory system, heart problems, medication side effects. Okay, so it can come from many places. In general, though, it's thought to be a condition that has no underlying disease associated with it. Now, the research that I read calls these noises phantom noises. And they're things like the following: humming, clicking, buzzing, hissing, roaring like a river, rhythmic pulsation, almost like a heartbeat or blood flow through arteries, and a whooshing sound. The majority of people with tinnitus have what is called subjective tinnitus, meaning that only they can hear these noises. And to make it a little more complex, noises come in different tones, pitches, and volumes. Some can be so loud that they interfere with the individual's ability to think, to concentrate, to work. But think about how dangerous that can be too. You're driving and you have this banging noise in your ears. It could distract you from driving. If you're working in factories, if you're in the military, if you work with your hands, if you're in an industry or whatnot, I can imagine that this can be pretty terrible condition. What are some causes? Meniere's disease. This is an inner ear disorder caused by abnormal inner ear fluid pressure. changes in the ear bone, blood vessel disorders, acoustic neuroma, which is a non-cancerous tumor of the cranial nerve. Okay, muscle spasms in the ear, and what is called temporomandibular, joint disorders. It's a tongue twister. And these are problems with the joint on each ear of the head right in front of the ears. So there are some risk factors, obviously, loud noises, prolonged exposure to very loud sources like chainsaws, firearms, heavy equipment. Workplace sources can be factories, construction sites, being in the military, and something I should have been worried about for a very long time. My parents used to scream at me when I put my amplifier on 10, being a hard rocker, punk rocker that I've been for the past, 45 years of my life. Being a musician, being an active, working musician, you're surrounding yourself with a wall of sound. Okay. Now, tinnitus is tinnitus. It's a condition all by itself. Unfortunately, it causes problems with other health conditions. It has co-occurring disorders associated with it. It can cause life-changing situations and problems like academic or occupational problems, stress, anxiety, and irritability, mood changes, depression, fatigue, problems with getting good sleep at night if your ears are ringing all night long, memory and concentration problems, and chronic headaches. Okay, so that's my overview. What I want to do now is go into the research. There's not a lot. Disclaimer, spoiler alert, not a lot of research. Unfortunately, there's not a lot of research on CBD and tinnitus specifically. But from the scan amount that I did find, it appears that CBD may be effective for tinnitus itself, but even better for some of the co-occurring conditions associated with it. So if you do have this condition, if you know someone with this condition, please share this video or the article, because here is what researchers, not me, here's what researchers have found. Researchers have conducted studies examining the effects of CBD for symptoms of tinnitus, and the results have been promising. Specifically, 2 cannabinoid receptors in the brain. I talk about this a lot in my book, Living Longer and Stronger with CBD. These 2 cannabinoid receptors are CB1 and CB2. They respond, when you take CBD, those receptors respond to the tincture or the soft gel or whatever you're taking, and the CBD appears to impact, as it interacts with CB1 and CB2, balance and hearing. These are both well-known issues to be problematic with tendinitis. I have to admit to you, I did not know this when I was writing the book. Okay, help with co-occurring conditions. What else does CBD do to help people with tinnitus? Evidence published in 2 prestigious journals, and I'm on these all the time. I'm on hundreds of journals all year long. Neurotherapeutics, look it up, and the Hearing Journal. They both provide evidence that CBD helps conditions like stress and anxiety, especially the types experienced by people with tinnitus. If we don't have tinnitus, we have stress and anxiety all by itself, right? Throw tinnitus in there. It exacerbates stress. It worsens anxiety or depression or mood. That's a no-brainer. It can also help people reduce the cycle of worry about their condition, as well as improve their ability to cope. So if I have tinnitus and it comes and goes, I might get into the cycle about worrying, when's it coming back? When's it coming back? It's almost like having a panic attack. I may not have another one, but I worry about having another one. And then we get into these neuroses that complicate things. It's also thought that since CBD can reduce anxiety, as has been shown in numerous studies, some of its other qualities, like helping with insomnia, the ability to concentrate, and reducing depression, may be seen in people with tinnitus. My takeaway, I'm hopeful. I'm hopeful, and I think it's worth a try. Seek out an audiologist. Seek out hearing care specialists first. Let them know if you want to try CBD. But it might be worth it. So there you go. The little bit of research that I could find, I wanted to share with you. Hope you enjoyed it. Hope you get something from it. Visit me at collinslearning.com, CEU.academy, and drjimcollins.com, as well as Sapphire-Essentials.com. I'm all over the place. See you soon.